yourself and managing your mental and physical health in college. I will turn it over to Dr. Christina from our counseling and psychological services staff.
Hello, everyone. Thanks for tuning in tonight. My name is Dr. Christina Vandervried. I am the staff psychologist at the law school, and I'm also, I work on the main campus with the undergraduate students, along with my team at CAPS. And I'll be presenting a little later on tonight, and I'll send it over to Diane Lynch here.
Hi, everyone. My name is Diane Lynch. I'm a nurse practitioner in health services, and I've been serving as director there for the last 6 years. And I would like to talk to you a little bit tonight about some of the services we provide, and hopefully if you have any questions, I'd be happy to answer them for you as well. So this is health services. Health services is located directly across the street from the main campus in South Orange. Our services are available to all matriculated students at Seton Hall. So no matter which campus you're on, you're welcome to use our services. This is a list of our staff. So we do have a few people that you'll probably be likely to interact with, and the front desk staff, Martha and Kathy, they are there to welcome you and to answer any questions you have regarding your immunization records and requirements, or any questions related to insurance or billing. And I want to encourage you to feel free to ask questions, but we do accept all insurances, so you don't have to have the school insurance to come to health services. Staff-wise, we also have a few registered nurses, a couple nurse practitioners, and some sports medicine physicians that we have contracted with who also do primary care. So it's great that we have a wide range of people available in the office to meet your health needs. This is just a picture of all of us. This is me before keratin treatment in the first picture, Dr. Mascaro, Susan, one of our nurses, Martha over on the end there. We have Sharon down below, Kristen, who's also a Seton Hall graduate, by the way. She's one of our RNs, and Kathy Yondo, who handles our medical records. So our service hours are Monday through Friday, 8:45 to 4:45. We are especially hoping that you will make an appointment, because along with our sick visits, we do see well visits. So people will be coming into the office for physicals and other types of things like vaccinations, labs, and so forth. So we like to schedule things in a way where, there's not a lot of people in the waiting area. So if you call, or we also have an online portal where you can schedule a visit. Those two methods would be much easier for both you and for the front desk people. If you just let us know when you want to come in. Usually we can accommodate same-day appointments too. And we're also going to be probably offering telemedicine this year in addition to in-office visits, but that schedule is still kind of being worked out. There's no charge for you when you come into the office. We will bill your insurance company, and there are some fees for vaccines and medications, but if there's a chance that you would be billed any amount of money for any service, that will be explained to you during the visit. For the most part, we try to keep the charges to you very minimal or free. And all visits, this is sometimes an issue for students. They worry about, who will find out about their visit. Visits are confidential, and that's required by federal law. The only people we can share information with regarding your visits are people that you specifically give us permission to talk to about your visit. So this even extends to your parents. Many times students will want us to communicate with their parents. And we are okay with doing that, but we will ask you for your permission before we do that. One of the things that we like to do is to try to help students to become more knowledgeable about how to take care of your own health, and just knowing a little bit more about how to navigate the health system. So one of the first things that, for some of you, it'll be like, a new experience going to a doctor's office, without your parents with you. So if it is, just make sure that, that you bring an insurance card with you or take a picture of it. A lot of times students will have a picture on their phone. It's more important for you if you're going off campus to a healthcare provider, but it's a good habit to get into. If you come to health services and you don't have your insurance card, you do not have to worry. So, but in general, if you're going to a healthcare provider off campus, they're going to expect that you have that information at the time of your visit. Know your allergies. And believe it or not, a lot of times people may not know what those allergies are. So if you do have allergies, make sure you know what they are, and it's helpful to know what type of reaction you had. Make sure that you pack some first aid supplies when you come to school, and some frequently used medications. So when I say frequently used medications, you have to think about those things that, are very common. So if you can probably assume that maybe once during the year you may get a cold. So coming to school and having maybe the type of medication that you use at home when you're treating a cold would be helpful for you to have on campus as well. Things for headaches, those are also very common things that come up for students. If you don't have those things, there are local pharmacies in the area, and we actually have some sample medications in health services. But because we're not there 24 hours a day, 7 days a week, having these items, in your room can be very helpful. Staying healthy in college. So one thing that we would recommend, and I think this might be mentioned in more than one slide tonight, but getting the vaccines that are required before you come to school is definitely a great idea. So for college students, there's a couple things that we worry about specifically, because you're living, sometimes you're sharing space with others on campus. And there are a couple things that are just more common for your age group. So, so making sure that you have protection against meningitis, and also considering getting a flu shot and a COVID shot for this year would be a great way to make sure that, you have the best odds for having a nice and healthy semester and, year. Also, don't forget like those common things that, that your mom has probably told you or your family about washing your hands and making sure that you get enough sleep. Usually when you're sleep deprived, unfortunately, it does make you more susceptible to getting things that might be going around. So getting proper sleep, eating regularly, exercising regularly, these are all important ways to help you to stay healthy. And if you're staying healthy, that means that you're probably going to also be doing better in your classes as well. Okay, so this slide is related to COVID, and as much as we would like COVID to go away completely, probably it's still going to be a little bit of an issue this year. Hopefully it won't be as much of an issue as it has been during the past year, but I want to give you a couple tips in terms of the upcoming year on this topic. So first of all, there's a committee on campus called the Health Information Communication Team, and you will get a message, an email every week that kind of gives you updates on, both what's happening in the community COVID-wise and also what the campus is doing to kind of keep everyone healthy and well. So be sure to, open up those emails. Sometimes there'll be important information in there. And if you miss an email and you can't find it, there's a way where you can just go into the Seton Hall browser and just search Health Information Communication Team. And you'll get like a whole list of information regarding COVID and, recent communications. The second thing I want to mention is that hopefully we won't see quite as much transmission because we will have many more people that are vaccinated. But if you do have any symptoms, don't wait, call us because the vaccine is designed to prevent serious illness. But many times people may still get mild illness. So we want to make sure, and especially in your age group, that we don't assume that, that it's just a cold and that we do, test you if you do have anything, even mild symptoms. And that's just to protect those people who are most vulnerable. So it's a simple test. It's a quick test. You get the results the very same day, actually within 15 to 20 minutes. And this way, if it's just a cold, it's just a cold. But if it did turn out to be COVID, we can make sure that we protect, other people in the community, and that will hopefully help us to all be a little bit healthier this year. Basic stuff like washing your hands, making sure that you're vaccinated against the cold and, against COVID and the flu this year, cleaning those high-touch surfaces in your room. So, light switches, doorknobs, maybe the faucet handles. Those are all ways that you can stay healthier, and they protect you against not only COVID, but just about any other kind of viral illness that might be going around. We should not have as many restrictions surrounding COVID this year, but keep an eye on some signage. If you see it around campus, it'll probably be mostly hand washing at this point. But, the COVID situation kind of is still kind of changing. So we need to kind of just stay aware. And, if there is any kind of increased transmission, there may be some changes in how we protect ourselves. And that's pretty much it for that. This is just the contact information, our office phone, fax. We also have a Twitter, and we do have an email. And if you go to our website, what I will say is that we have a lot of information there that you might find helpful. There's information about how to complete your immunization requirements. We have like a little tutorial there. We have all of our contact information there for different staff, and all of the information you see here on how to contact us.
Okay, thank you, Diane.
You're welcome.
If I can you just mute Diane, because I'm getting an echo. Okay, so perfect. So again, my name is Dr. Christina Vandevried, and I am a psychologist at CAPS, Counseling and Psychological Services. So this first slide shows you kind of a little bit about what we look like. I don't have everybody's photo up there, but our director, Dr. Diane Aguero Trotter, is the leader, and the other person who you might see is the person down in this right-hand corner, Joyce Seton. She's our secretary, and she's a kind and sweet person. So if you ever are in a situation where you need to use CAPS, you'll probably be seeing her face. You can advance to the next slide. So counseling and psychological services is a little bit different, obviously, than health services, because we focus just on the mind and your emotional well-being. So we are real psychologists. I'm licensed in the state of New Jersey, and we have a staff of psychologists and even licensed clinical social workers on staff, on campus, in person, 5 days a week from 9 to 5. So if you have a crisis, if there's something going on where you're concerned about a roommate, anything like that, first line is you often will go to your RA first, and they can really point you in the right direction. But if you need a consultation or you're looking to get some help with some emotional stuff that's going on, whether it's anxiety, depression, something, test anxiety, a lot of times that first semester adjusting to college, something like homesickness can manifest in some really distressing ways, you know, and so we're there for that. So we provide a lot of services all in one place. So we do real therapy, but it's a short-term model. You know, we're not the kind of therapy where you're going to be coming in multiple times a week or anything crazy like that. That if you needed that kind of help, we would refer you to someone who could be there for you much more frequently. But we are there. We also have 24/7, you can call our number. And you won't be connected to us directly, but if you call that number 24/7, there will be somebody there to answer the phone, a live human being who can either help you set up an appointment, connect you to a crisis line, or even just talk to you in the moment to do some crisis help with emergencies. Again, we do short-term individual counseling. So we don't do any couples counseling. It does tend to be short-term. Most people who come in, they're there for about 4 to 6 sessions, something like that, maybe more, maybe less. We also have some groups that we offer, which can be really helpful. Group work, stress and anxiety management group. We have other groups that are starting up, managing your moods, different things like that. So check out our webpage, and you know, if you ever having trouble, we could get you connected with a group. We also actually do have a psychiatric nurse practitioner on staff. And again, that's for very limited situations, but definitely if someone is in a situation where they're having depression or they're having anxiety and they need medication, we can make a referral to Kathleen Prendergast, who's on our staff. She's very short, she's there part-time, Tuesdays and I think Mondays and Thursdays. Don't quote me on that. And usually what she'll do is she'll help get you stabilized on medication, and then eventually we would refer you out to the community to a provider who could see you long term. There is one big exception to that, and it is that we do not provide any medication for ADHD. any stimulant medications like Ritalin or Adderall. We don't provide those. Off-campus referrals. So we do have kind of a referral model. So if you do need more long-term help, we would want to refer to you someone off campus, because the natural flow of the semester, we have breaks in the winter, we have breaks in the summer, spring break, and if you need consistent care, we wouldn't want you to have those big drops in treatment. So we would refer you to someone in the community. We also have self-help resources and a lot of different resources on our website, which we think are kind of fun. Where do you go for the ADHD prescription support? Great question. So if you were to come into CAP services, and we did an assessment and we realized, oh my goodness, you're really struggling with attention and we'd want you to get evaluated, we would provide a referral to someone in the community who could do that evaluation and provide the appropriate medication for you at that time. Yeah, good question. And I do want to just contrast our model with health services. So health services takes insurance and there is fees associated with different things. So our services are actually a little bit different. There's absolutely no charge. There's absolutely no, you do not need to bring your insurance card in, nothing. So to meet with any of our providers, it's just part of student services. It's almost as if like when you're meeting with your advisor, you don't have to pay, so we are just part of your student services service. We are at your service to help you. So you do not need to have insurance in order to come see us. So we actually do have some clients who don't have any insurance at all, and this is the only way they can get care, right? So you don't have to give us an insurance card, you don't have to give us a copay, and there's no one would know about your care. Same as health services, we have all the privacy and confidentiality that's guaranteed with you in doctor-patient privilege. So that is one difference. Like some people will ask, oh, do we need to tell you our insurance information? And we actually don't need that information. So that is something that some students find very helpful, because the nature of psychological services can be very sensitive and very private. So it's a nice little advantage to us being under student services. A lot of, if we have parents feel there, I don't know if you all see this question. If we as parents feel that there is, oops, just lost it now, something going on with our child, can we reach out to you? Great question. So we get this quite a bit. And so, yes, parents do reach out to us and you can reach out to us. The tricky part is that because of HIPAA and confidentiality, you can reach out to us and let us know what might be going on with your child. And what we do with that information is we take down your name and the student's name and we put it into our database. However, we don't call your student on campus and ask them to make an appointment with us, because first of all, some students find that very, they don't want that. They don't want us to call them because they can almost find it harassing, right? So, and also we want the students to have a sense of agency and be setting up these appointments on their own. So that's a good question. You can call us and let us know and maybe give us information, but we can't tell you about the student unless we have a release of information, and we will not reach out to the student directly to say, hey, your mom called and they want you to make an appointment, so let's get you set up. Like, we need them to call us. And that sometimes is really, really frustrating because of the nature of depression. Sometimes the student isn't motivated to call us, right? And so it puts everybody in like a really tough double bind situation. So we really want the student to be able to make the appointment. Good question. That's a very good question. The third little column there, campus outreach. We do a ton of outreach. Technically what I'm doing right now is considered outreach, right? So we educate, we provide information to the student population. We meet with all different student clubs from fraternities, the psychology club. We have a student athlete liaison who's meeting with the athletes frequently. We also have embedded psychologists. So I'm an embedded psychologist at the law school. I have a colleague who's an embedded psychologist at the IMS medical campus. We do interactive workshops, a lot of interactive stuff with COVID. It was pretty interesting, classroom presentations, et cetera, et cetera. So lots of outreach where students who never step foot inside a therapy room will still kind of have some sort of interaction with us. Okay. So thank you for your answer. So who do we give the HIPAA form to? Okay, great question. So we have release of information forms. And so if you were to talk to a counselor, they could email you the form, right? It's a release of information form standard that you'd see at any doctor's office. And then you would have the student sign the bottom, giving permission for CAPS to speak with you, the parent, at the top. So it's like, John Doe student gives permission for parent Doe to exchange information with CAPS services, signed John Doe student on the bottom. So that's how it would work. Yeah, so you could get those release of information from whoever you speak to on the phone when you call, and we'll email that over to you, and you can just scan it back to us, and then we have it, and then we have the release. But we still wouldn't be able to call the student and ask the student to make the appointment. The student still has to make the appointment on their own, or just walk into CAPS, and they can just make it, because a lot of students don't like to call on the phone. Just walk into CAPS and make the appointment. So this might seem like a little bit of an abrupt transition, but one of the big things, and Diane already spoke about it, is so counseling and psychological services, we're there when things have already kind of started to go wrong, but a lot of the outreach and work we do is to help prevent things from going wrong in the first place. And I think as we start going to college and we're on our own, it's really the simple things that help keep us healthy. And it's all the stuff that you've heard about a million times before. And so the 4 bullet points on here, I think these are very important things. And they became so clearly important during COVID over this past year when we lost them. For example, make a routine. When COVID happened, everybody's routines went out the window. Everybody thought, oh, this is great. And so we encourage students to maintain some sort of a routine. Go to sleep at a normal time. Wake up at a consistent time. Do exercise. Do move your body. And try to manage your time appropriately. This will be a huge factor to you being successful in school. If some of those things get thrown off, sleep, your physical health, or your managing of your time, that's when psychological problems actually can really creep in, right? Sleep deprivation is actually the number one thing that I talk to every single person about. I just always want to know how their sleep is, because without good sleep, mental health can elude us. Social support and counseling. So another thing that's really hard in the beginning when you transition to college is who's your social support network? Well, you just left them all at home. Now you have to create a new one here. So putting effort into developing that social network is well worth it, because that will be the squad that kind of supports you through college. And things change, of course, but it's important to look for and try to find social support. Setting boundaries, whatever those boundaries may be. So this takes self-reflection, paying attention to what makes you uncomfortable, and setting a boundary before you get there. Whether that's behavior, interactions, food, everything. Learning how to set boundaries is another part of that self-regulation. And it's a real important thing that we typically tend to learn in college, because a lot of boundaries have been set for us up until this time. The last thing, relaxation skills and apps. There's 100,000 of them out there now, teaching you how to do breathing and mindfulness and relaxation. And it all seems kind of silly sometimes, but I'm going to tell you, if you talk to people who do these things regularly on a daily basis, it does make a world of difference for your health. And it teaches your body how to relax, so that when you are in a stressful time, you can tell your mind, okay, I need to relax. And your body will almost follow up and relax. I wanted to just pause a minute, because I think I gave out some bad information that Diane needs to correct. I think I said that you need insurance to go to health services, and I think that's inaccurate. So Diane, can you please correct me before I give any more bad information?
Oh, no, that's okay. I was worried that I just want to make sure I communicate it correctly, because I think, it might have come across as if you did need to have insurance. We encourage students to have insurance because lots of times, like, you may need to go to a healthcare provider off campus for some reason. We're hoping that, that you will come to visit us, and we do not require insurance. So if you don't have insurance, like if something happens during the year, you lose your insurance or in between insurance, we're not going to charge you for your visit. So I just want to make sure that you know that, and it doesn't matter what insurance you have. Like, sometimes students think, well, if they didn't take the university insurance, that that they can't come to health services. That's not true at all. The other thing is that, like, sometimes people will have deductibles or copays. The benefit of coming to health services is that you do not have to pay a deductible or a copay when you come to see us. So compared to going to an urgent care or another off-site healthcare provider, you always will save money coming to us. The pharmacy items, we charge you only what it costs us to purchase them. So you always have the option of getting a prescription that you can take to the pharmacy, but should you want to take advantage of the convenience of getting the medication from health services, we have, many of the commonly prescribed medications that, that you might be likely to need. So that was essentially, I just wanted to make sure that that we cleared that up so that you realize that you don't need insurance to come to us.
Thank you. Good. I'm glad that actually clarifies it. I spoke out of turn there. So yeah, self-care. It's a big one. Resources. This is just a bunch of images of some of those apps that I've mentioned. One that I like to use with clients is called Calm, but that is an app you do have to pay for. So there's on the screen there's this little there's like a little video. So we have these videos called What's Up Doc, where little educational videos. So you can familiarize yourself with our website, and you can look for additional mental health resources that we have there. I just wanted to talk a little bit about COVID. So for the past 14 months, all of our therapy sessions have been virtual. However, starting back up in the fall, we will be back in office, which is kind of a big deal. So our model is you come to the office, you can make an appointment. In the beginning of the semester, we have a lot of appointments, but if you want to get an appointment, you have to call the number or walk into the office to make the appointment. We unfortunately do not have the online booking system that health services had. Just because there's a couple privacy issues and it's that same thing, we want to make sure that the person making the appointment is the person who the appointment is for. Again, the nature of psychological services can be very sensitive, and we don't want people to be booked into appointments that they don't really want to go to. But we are there. We are in person. We will be doing in-person sessions. And I do believe, we don't have all the details on this yet, but I do believe that we will be able to still offer teletherapy on an as-needed basis. There's a variety of reasons. Accessibility is one, for example, weekend or commuter students. So there's a variety of different things that might mean you could still do virtual sessions. We don't have all the details on that figured out exactly yet. In the case of a psychological emergency, and this does happen, you can walk right into CAP services between 9 and 5, and we always have, we call it a pod, psychologist on duty. We always have a psychologist who's on call. So like they can't schedule any clients during that block of time, and they're there if someone walks in with a psychological emergency, and we can work with whatever they need at that time, whether it's connecting to home or to an outside resources, or even if hospitalization or if it's a serious emergency that needs more attention. So we are there between 9 and 5. If it's outside 9 to 5, you're encouraged to either call 911, call public safety. You also can call public safety or 911 at any time as well. You don't have to come to CAPS services. We still do encourage you to call before you come in, because then we can make sure that we can make an appointment for you. So you're not just, you have that full hour with a psychologist. I think that's all. Oh, and everyone on staff has been vaccinated and so we will follow appropriate protocols. So here's this magical number that I've been referencing that is important to call. It's the 9500. So 761-9500. We are in Mooney Hall, which you'll find on campus. It's right off that main quad and on the second floor. So you come up to the second floor and we have a whole hallway there of all our little offices from 9 to 5 on Monday through Friday. Okay, so this would be a time when Diane and I could answer your questions. I think I was able to answer a couple of them along the way, but if anybody has questions, please feel free to put them in the chat, or you can even use your real voice if you're brave and you just want to talk using your real voice here. We're happy to answer any questions.
I thought of one more thing that I'd like to share. It just popped into my head on the COVID topic. Because most places on campus, students who are vaccinated will no longer have to wear masks. I just wanted to point out that in our office is the one exception to that. Because we see students who sometimes have symptoms, we do ask that if you come to health services, that you wear a mask when you're in our office. And if for some reason you got across the street and you didn't have your mask, all you have to do is just call the number on the front door and somebody will assist you. We can give you a mask to put on so that it just keeps you safe and, other people in the office.
Yeah, Judith.
I'm sorry. Hi, it's me. I'll be the brave one and I'll ask a question. Most of the time kids have issues basically because of us parents. What kind of common issues should we not freak out about when we send our first one off to college? Like what of things are normal or common, or that we should just sit tight and let them figure it out? Or when should we, or what kind of alerts or things should we be looking for?
Great question. I would say the main thing that's very typical, I can tell you from my own experience, is homesickness. And homesickness comes in a lot of different forms. Everything from tearfulness and crying to just kind of being irritable or aloof, distant. So homesickness is regular. Things you want to look out for is when you notice a dramatic change, either an increase or a decrease in functioning. So for example, an increase would be like, oh, I haven't slept in 3 days and I'm going. Like, whoa, why haven't you slept? That's too much. Or the decrease would be like, oh, I've been sleeping 14 hours a day. I'm just so tired all the time. So that same thing with food, binge eating, not eating, or all those kinds of this is atypical. So when you start to see things that are concerning, or normal sadness is like, I miss you guys, I've been crying. And then the difference would be they feel like I can't do this anymore. Getting desperate, like that feeling of desperation. Those types of things, start to refer them to CAPS. We can do an assessment and we can maybe parse out with them like where they're at. And we can always bring the parent in at that point once they're already in. But those are the things that come to mind. Does anything come to your mind, Diane?
No, I think I think you covered that. And You know, I mean, from my standpoint, like, you know, I think like when it comes to, you know, sending your child off, you know, it is a scary thing for them to be, you know, to be in a different place. And, you know, if they're not feeling well, you know, I know that that's anxiety producing. I mean, I have children myself, so I can relate to that. But I think like, you know, just recognize the fact that, you know, like we will go out of our way, like, you know, to really help them as much as we can. You know, we're not there 24/7, so what I would recommend is just making sure that they have some of those things that you would, you know, give them if they were home and they weren't feeling well, because they're going to reach out to you. Chances are, you know, they'll reach out to you before they even reach out to us. So we really like to have, you know, a good communication with parents in terms of our services, because we know that they're going to reach out to you first. So we want you to kind of be aware of what we do too, so that you can kind of just encourage them to come over. You know, we have so many different types of students. Some are very outgoing, some not so much. So, but we're used to working with all of them, and we really have the luxury of spending the time with them, more time than, you know, that they would typically get if they went to just any old healthcare provider, like in an urgent care. Like, we're not rushing them. We make sure that we talk to them. We make sure they understand like the treatment plan. You know, if they want us to talk to a parent, we, you know, we will talk to a parent. So it is, you know, we consider you part of the team. And I see there is a question here on the chat about, you know, signing a permission up front to share health information with parents. The only thing I would say about that is in health services, we do not have that type of form. We do, we have students sign permission on a case-by-case basis. So, you know, it has to be associated with, you know, their visit that day. And of course, there are exceptions, like if there's an emergency.
I think Diane froze for a moment, but, or maybe I froze. Did I freeze? Where is everybody? I guess you can still hear me. I'm just going to talk. Oh, no. Hello? Hi. I'm going to talk and just assume people can hear me. Okay. So we don't need a release every time. So what might happen if your child comes into treatment and they sign a release of information for us to speak with you, that the date that they talk to us, that's the start date. And then that release is good for a year or until they revoke it. So they can come in and say, you know, you can talk to my parents for the next, but like if they're in ongoing treatment with us and the release is signed, then there is a freer flow of communication. But we tend to just talk about, we don't tend to talk too much about the content of the session. We talk more about the progress of the case and how the student's doing overall. We still try to keep confidentiality and their privacy in some ways, but it's all depends on the case and what's needed, like as needed information. So we're not trying to be secretive or anything like that. So I think we lost Diane. Which is too bad, but okay. Oh, there she is.
I'm back. Hi.
So sorry. My computer died on me.
Do we have any other questions? Or Olivia, did you notice anything that we needed to be attending to?
I do see somebody is typing, but I think other than that, we should be all good. We are running up on time, so get your last minute questions in.
In case of any mental health issues for which parents can help. Can the parents be engaged? Yeah, I think so. It all depends on the case. There's some cases where it's really important to have the parents on board and to work collaboratively, particularly if, you know, the student has struggled with things in the past and the parent probably definitely knows way more about the situation than we do, right? So to have that collateral information and collaboration with the parent is very helpful, so long as the student is okay with you being involved in their treatment. We like that kind of collaboration. Yeah. Anyone else typing? And again, if you have more specific questions about this, because we do have time, but like we're running up on time, you can give us a call at CAPS, and ask a few more of these questions just to clarify. I'm not perfect, so I might have said something a little bit off, but I think I tried to be as informative as possible. Okay.
All right, I'm thinking that nobody else has any more questions, so I think I'm going to stop the recording and say have a good night, everybody. And of course, you can contact us. You'll have access to the chat, so you could always find the information again, or you could go to the SHU website, shu.edu, and type in CAPS or Health Services, and all the information will be there as well.
Thank you, everyone, for coming tonight.
Thank you.